Tachycardia. D. Hypotension. Answer. D. Hypotension. Explanation. Opioids are a class of medication commonly used for pain management. They can cause several side effects, including respiratory depression, sedation, nausea and vomiting, and hypotension. Hypotension is a particularly concerning side effect, as it can lead to decreased perfusion of vital organs and potentially life-threatening complications. Question 2. Which of the following is an example of an appropriate intervention for a patient experiencing delirium? A. Restraining the patient to prevent falls. B. Administering sedatives to calm the patient. C. Providing a quiet and calm environment. D. Encouraging the patient to watch television. Answer. C. Providing a quiet and calm environment. Explanation. Delirium is a serious condition characterized by acute changes in mental status, confusion, and altered perception. It is often caused by an underlying medical condition or medication side effect. Providing a quiet and calm environment can help reduce stimulation and improve the patient's mental status. Restraints and sedatives should be avoided, as they can worsen delirium and increase the risk of complications. Question 3. Which of the following is an example of a risk factor for developing pressure ulcers? A. Adequate hydration. B. Turning and repositioning every 8 hours. C. Impaired mobility. D. Regular use of moisturizing lotion. Answer. C. Impaired mobility. Explanation. Pressure ulcers, also known as bed sores or decubitus ulcers, are a common complication among patients with impaired mobility. Immobility can lead to increased pressure on certain areas of the body, particularly bony prominences, which can lead to tissue damage and ulcer formation. Adequate hydration, turning and repositioning, and moisturizing can help prevent pressure ulcers, but impaired mobility is a significant risk factor. Question 4. Which of the following is an example of an appropriate nursing intervention for a patient with a fever? A. Administering aspirin to reduce fever. B. Encouraging fluid intake to prevent dehydration. C. Administering a cooling blanket to decrease body temperature. D. Encouraging the patient to wear warm clothing. Answer. B. Encouraging fluid intake to prevent dehydration. Explanation. Fever is a common symptom of many illnesses and can cause discomfort and dehydration and promote hydration. Aspirin is generally not recommended for fever management, particularly in children, due to the risk of Reyes syndrome. Cooling blankets may be used in some cases to manage fever, but the primary focus should be on hydration. Question 5. Which of the following is an example of a symptom of hypoglycemia? A. Polyuria. B. Hyperglycemia. C. Blurred vision. D. Hypotension. Answer. C. Blurred vision. Explanation. Hypoglycemia, or low blood sugar, is a common complication among patients with diabetes. It can cause several symptoms, including confusion, sweating, shakiness, and blurred vision. Polyuria is a symptom of hyperglycemia, or high blood sugar. Hypotension is a potential side effect of some diabetes medications. Question 6. Which of the following is an example of an appropriate nursing intervention for a patient with a urinary tract infection? A. Administering antacids to decrease stomach acidity. B. Encouraging the patient to drink plenty of fluids. C. Administering antihistamines to reduce inflammation. D. Encouraging the patient to avoid caffeine. Answer. B. Encouraging the patient to drink plenty of fluids. Explanation. Urinary tract infections, UTIs, are common infections that can cause discomfort and pain. Encouraging the patient to drink plenty of fluids can help flush out the bacteria causing the infection and prevent dehydration. Antacids and antihistamines are not appropriate interventions for UTIs. Avoiding caffeine may be helpful in preventing irritation of the urinary tract, but it is not a primary intervention. Question 7. Which of the following is an example of an appropriate nursing intervention for a patient with a history of falls? A. Restraining the patient to prevent falls. B. Encouraging the patient to wear non-slip socks. C. Placing the patient in a room with limited access to mobility aids. D. Implementing a fall prevention program. Answer. D. Implementing a fall prevention program. Explanation. Patients with a history of falls are at increased risk for future falls and associated injuries. Implementing a fall prevention program can help reduce the risk of falls and promote patient safety. This may include strategies such as bed alarms, frequent rounding, and environmental modifications. Restraints and limiting access to mobility aids can be harmful and should be avoided. Question 8. Which of the following is an example of an appropriate nursing intervention for a patient with a respiratory infection? A. Administering corticosteroids to reduce inflammation. B. Administering antibiotics to treat bacterial infections. C. Encouraging the patient to avoid coughing and deep breathing. D. Placing the patient in a supine position. Answer. B. Administering antibiotics to treat bacterial infections. Explanation. Respiratory infections can be caused by viruses or bacteria. Antibiotics are only effective against bacterial infections and should only be used when appropriate. Corticosteroids may be used in some cases to reduce inflammation, but they are not the first-line treatment for respiratory infections. Encouraging the patient to cough and deep breathe can help improve lung function, and the supine position is not optimal for respiratory function. Question 9. Which of the following is an example of a potential complication of intravenous therapy? A. Hypotension. B. Hypoglycemia. C. Hypertension. D. Hypoxia. Answer. A. Hypotension. Explanation. Intravenous therapy is a common intervention used to administer fluids, medications, and other treatments directly into the bloodstream. It can cause several potential complications, including infection, thrombosis, and hypotension. Hypotension is a particularly concerning complication, as it can lead to decreased perfusion of vital organs and potentially life-threatening complications. Question 10. Which of the following is an example of an appropriate nursing intervention for a patient with a new colostomy? A. Administering laxatives to promote bowel movements. B. Encouraging the patient to avoid high-fiber foods. C. Providing education on stomach care and appliance management. D. Restricting fluid intake to reduce output volume. Answer. C. Providing education on stomach care and appliance management. Explanation. A colostomy is a surgical procedure that involves creating an opening in the abdominal wall to allow feces to exit the body. Patients with new colostomies require education on stomach care and appliance management to ensure proper functioning and prevent complications. Laxatives and high-fiber foods may need to be restricted or modified depending on the patient's condition and specific needs. Restricting fluid intake can lead to dehydration and should be avoided. Thanks for watching.